Following the outbreak of cholera in Ogun State, the state government has expressed its readiness to ensure that the virus does not spread across the state. The Commissioner for Health, Dr. Koga, disclosed this at a press conference held in Abeokuta, the state capital. Koka revealed that 25 suspected cases of cholera had been recorded in 7 local government areas of the state. Koka, alongside his environment counterpart, Mr. Ola Oresoyan, named the local government as Ado-Dota, Remo North, Odeda, Shagamu, Ijebu North, Iwekuru, and Obafemi local government areas. According to Dr. Koka, our ministry is collaborating with relevant stakeholders from the Ministry of Environment, Information and Education, Water Corporation, private hospital owners, emergency, and among others. Koka identified contaminated foods, drinks, unhygienic sanitary conditions, and poor personal hygiene as some of the risk factors of the disease, imploring the people to imbibe hand hygiene, washing of food, vegetables, fruits properly before eating, as well as avoid open defecation so as not to contact the sickness. He noted that the state government was aware of the threat posed by the outbreak and was at all times at alert by putting in place adequate preparation to protect the lives and health of all residents, adding that this has helped to minimize the impact of the outbreak when compared with other states. The commissioner emphasized that the federal government, through the Nigerian Center for Disease Control (NCDC), has been supportive in the areas of technical assistance and supplying protective gears to the officials.
At the inception, we received the alert on the 12th of June 2024 about the first 2 cases. Both cases tested positive with a cholera rapid diagnostic kit and were managed at the State Hospital, Ota. The cases had travel history to Lagos State 24 hours prior to their presentation. As of today, the 24th of June 2024, Ogun State has recorded 25 suspected cases and in 7 LGAs, namely Ado-Dota, Remo North, Odeda, Shagamu, Ijebu North, Iwekuru, and Obafemi Owode, with 9 confirmed cases with the rapid test kit. Unfortunately, we reported a death at Ijebu North. Consequent upon these findings, it is imperative for us in Ogun State to declare an ongoing cholera outbreak in Ogun State. Prior to this, the cases had been sporadic, but in the last 72 hours, we've had a surge, and hence the reason why we've called this press conference. Prior to this outbreak, as part of our state preparedness, a robust surveillance system was in place in all our 20 local governments, which ensured prompt detection of cases. The initial 8 cases actually originated, the first 8 cases originated from Lagos State, which is the reported epicenter for the cholera outbreak in Nigeria at present. And it states that, and it shares borders with 4 of our local governments. As a way of warning, the risk factors for cholera include eating contaminated food and drinking unhygienic and drinking contaminated water, unhygienic sanitary conditions, and poor personal hygiene, particularly when we want to eat, ensuring that we wash our hands, and before eating our fruits, that we actually ensure that we wash them thoroughly, and we educate our children. Our children particularly are vulnerable because they go to school, the vendors are there, and we in Ministry of Health, we actually screen all the food vendors that present themselves to us at the ministry for all these bacterial diseases.
Contributing, the Commissioner for Environment, Mr. Ola Oresoyan, noted that since cholera would be transmitted through untreated water, his ministry has dispatched its officials with testing kits to test bowls and other resources of water supply, such as attention would be paid to those producing sachet water. The Environment Commissioner also disclosed that the public toilets are being built across the state to discourage open defecation, while landlords and house owners are being encouraged to provide toilet facilities in their houses.
Where we find out endemic. Don't forget that cases of cholera outbreak and contamination come especially during rainy season like this, where you have flood. So these are flood-related diseases also, cholera, typhoid, and the rest of it. And during flood season like this, you have runoffs from sewer lines, and they can contaminate even source of underground water supply. And many of the people who are into packaging water and using these boreholes for food packaging, food production and preparation, and especially food that will not be subjected to heat. Yes, there's a likelihood of contamination if you've had an experience of flood in these areas. So during the flooding season, things like this can happen. So we are all out now checking boreholes and well water supply for especially those who are into commercial use of this water supply, and they can distribute this problem easily if they are extracting water from contaminated sources.